This module will be on exploration and assessment, which is part of the UNCG health coaching framework. Exploration and assessment, they're really going on throughout the entirety of a health coaching session. But the idea is that after you've opened and set the agenda for the session, you have really focused time for exploration. And that may consist of reflecting or asking questions to really help the client dig deeper into their behaviors, their goals, their values or priorities. It may also consist of using tools and assessments to help guide that self-reflection for the client. It's exploration that really helps us lead up to the setting of agreements, as you can see in the UNCG Health Coaching Framework. So unless you've really taken the time to move through exploration, the goals and agreements that are set by the client could end up being meaningless. I also want to remind you that you can look in your manual through pages 17 through 24 to see an outline of what typically happens in each part of the UNCG Health Coaching Framework and how all of the pieces really fit together. We've already talked about some of the tools and strategies that are going to be most useful for exploration, those reflections, the open and powerful questions. So here we'll go through some of the tools that you have in your manual and how those tools could be used within the context of a coaching session. So first, let's break down what we really mean by exploration and assessment. What do you think of when you hear those words, exploration versus assessment? So exploration sounds more like a journey. It's less formalized, more emergent. And assessment can sound sometimes judgmental, as if there's some kind of gold standard to meet. Assessments can give us a lot of information in one quick survey or one big swoop, but exploration can sometimes take a lot more time. Both of these can have a place in your sessions. So some questions for you to reflect on right now is, what types of assessments might you already be using with clients? How do those assessments fit within the coaching spirit? And how could you incorporate more exploration within your practice? So let's talk more about some of the tools that can assist us with exploration. These would be things that are not mandated by healthcare settings or any agency. They can be more focused and detailed based on the direction of conversations with clients. And some examples of these might be well-being assessments, such as the Wheel of Life that you completed, or readiness for change scales. So we have a couple of examples to demonstrate both exploration and assessment. Now, keep in mind that these particular examples are very brief and they are very specific to gathering information about what the client already knows about using their inhaler. So as you watch each of these videos, think about the coaching spirit, think about the mindset shift, think about the communication styles that we've been talking about, and some of the skills that you've already learned. And then reflect on some of these questions. So how do these approaches differ? What scenarios would lend themselves to one approach over the other? And think about yourself in the position of the client. What approach would work best for you? Would that change depending on what behavior you're wanting to focus on? Think specifically about that behavior that you've been wanting to change but haven't been successful yet. What types of exploration or assessment would you need? And just keep in mind, you may need both assessment and exploration in a session. And assessment could be focused more on, are you doing this behavior? How often? For how long? And exploration could be focused on, how's it going? What supports do you have in place that could help you be successful? How does this connect with what's really important to you? So here's the first video.
So Lori, I see Dr. Steele has prescribed for maintenance inhaler and the rescue inhaler. That's the one you take as the maintenance inhaler. That's the one you're using here. You're using that every single day, right? It's really important. I just can't tell you how important it is. You've got to use that every single day. It's going to help your symptoms stay better in the long run. And it's possible what happened. Please try to use that every single day. Try to use that every single day.
Okay, and here's the second video.
Hi, Lori. It's good to see you. Good to see you. How have you been feeling? Pretty good. Pretty good? Had good days. Yeah. So I hear that the doctor has prescribed some medication for you, and I'd like to talk about that a little bit today. So can you tell me what medicine your doctor has prescribed for your COPD?
Well, I have a maintenance inhaler and a rescue inhaler.
Okay, so you have two. And what are the differences between those inhalers?
Well, the maintenance is supposed to be for every day.
Okay.
And then the rescue is when I just absolutely can't catch my breath.
Okay.
And need extra help.
And how's that been working for you? Two medications?
Well, I feel like I really don't need the maintenance.
Okay.
That much. As long as I don't overdo it.
Okay. Do you notice a difference? And can you tell me about the differences that you feel when you take your medication?
Yes, I do feel better, but I just don't want to take it every day if I don't really need it every day.
So you don't really see the point in using your maintenance inhaler?
Yeah, not really. Because I just don't want to take so much medicine.
So you don't really see the value of taking your maintenance inhaler when you're not feeling bad?
Not really.
Right.
I really don't. I just try to watch my activity level, and that way I feel like I can control it without having to take so much medicine.
So on the one hand, you see the value of medication when you need it, but on the other hand, you don't want to take medication all the time.
Exactly.
I see what you're saying. Would it be helpful if I told you a little bit about the differences between the rescue and the maintenance inhaler, and tell me what you think?
So again, some of those questions to be reflecting on is, how do these approaches differ? What was the goal of each of those sessions or that clip that you saw? What types of scenarios that you've been in or that you could think of would lend themselves to one approach over the other? And what approach would work best for you? So I want to talk now about some of the tools that are in your manual. This is the Well Life Vision. It is on page 77 in your manual, and you may remember it as one of the homework assignments on the first day of training. These are examples of questions that can guide the process of exploration with the client. These questions help to connect the client's current goals with their overall vision for their well-being. Now, if you completed this worksheet for yourself, you may know that sometimes these questions can take a bit more time to really think through the meaningful answers. And I do encourage all of you, either on your own or maybe as a part of your buddy coaching experience, to complete these questions. Think about that behavior that you've been wanting to change but haven't done it yet. How does that behavior connect with your well life vision? And going through this process of completing your own well life vision, that can help us put ourselves in the shoes of the client. Oftentimes as clients, we have to be more vulnerable and share information that we didn't think we would be sharing with a stranger. And so this is another reason why the coaching spirit and that establishment of trust in your coaching relationship is so important, to help that client feel comfortable in sharing some of this deep information. We'll talk a little bit more about the Well Life Vision and how it connects with setting agreements in your sessions in that module. This one should also look familiar to you. This is the wellness wheel. It is on page 75 of your manual. This is just another informal assessment tool to help initiate the exploration process. This tool can be used to help expand the way that clients are thinking beyond just their physical health or that one health concern that they came to you for. This can help the client to discover their own connections between many different dimensions of their health and well-being. And I think using this tool within a coaching session, this can really help spark some beneficial conversations for the client, connecting their desired goals to their ideal visions for their health. Think about the mindset shift. I have often found this tool to be really helpful with encouraging a mindset shift towards seeing all aspects of well-being as connected and interrelated, and things that could be addressed with small actionable steps to get the client to their larger overarching goals. So how we often use this in coaching. After the client has filled out this wellness wheel, first you want to seek out some successes. So you could ask, tell me more about the area that you've scored the highest. What are some of the best things about that area right now? And you all started to go through that process in the training, talking about the area that you felt the best about. And sometimes that can be challenging, but it can also be empowering. So some of the reasons that we start with that higher ranked area is, one, to help encourage the mindset shift, to affirm for our clients that they are not broken, they do not need fixing, that they are whole, complete, and capable beings. And two, to help the client think about their successes, their supports, and their benefits, so that later we could ask questions to help the client reflect on ways to maybe create some synergy and opportunities in other well-being areas that may be based off of those strengths and those supports that they've utilized in those areas. And next, you may want to look for areas where the client is emotionally charged. And that can be either positive or negative. So you might just ask, what areas would you like to talk more about? Or what areas do you feel you've got a lot of energy or a lot of motivation? We could also look for areas where there's a high importance for the client. So what are some areas of priority for you? How important is this area for you right now? Another approach that can be really useful with this tool is to reflect or ask questions about gaps or inconsistencies that you notice in their responses. So you could say, tell me more about the areas that you've scored lower on this wheel. And what would it take to move from a 5 to maybe a 5.5 or a 6 in this area? And I know that each of you has experienced using this wheel for yourself, but remember that this wheel can change from time to time, and your ratings are going to go up and down in different areas. So this could also be a good exercise for you as the coach to use just to kind of see where your clients are and checking in. Maybe you want to use it as a pre-assessment and at the end of your coaching relationship, or maybe you just want to check in throughout that relationship to see where the client is. So another tool that we've used before is the bubble tool. There's an example of this on page 56 of your manual. And this tool can be used in a number of ways. It may be as simple as pulling out a blank piece of paper and just drawing some bubbles on there to let the client fill in some of the areas that are related to their overarching goal with health and wellness. What are some of the possibilities that they might want to talk about? You might even start the session with some of those bubbles already filled in. So this could help you recap a previous session, some things that you heard the client talk about, allowing them to see what they've talked about, to recall it, and to see maybe how it connects, and where to start the conversation for this particular coaching session. So really, this could be a useful agenda setting tool. It can help support the client's autonomy by encouraging them to choose which topic that they feel would be most meaningful for them to focus on. And I do recognize that in some cases, you may have to talk about a specific issue based on the role that you have, that you play in your agency. And that is okay. In these cases, you might consider just taking a few minutes to allow the client to discuss something that could be pressing on their mind, or just giving them some space to talk about something that's important to them. So, for example, you might say that your doctor really wants to address high cholesterol, but before we talk about that, we've got just a couple of minutes. Is there anything else that you'd like to talk about? I'll just talk about a couple of other ways that this tool could be used. So this is an example of how the bubble tool was used with a client who was really focused on improving self-management, stress management. The session was started with some bubbles already filled in, and those were based on a prior session where the coach noticed some significant areas that the client had mentioned that were contributing to their stress. So before the client comes in, the coach has some of these bubbles drawn up and some of them filled out. And before really focusing the conversation on a specific topic, you could continue to explore and ask the client to reflect on some of these bubbles that are filled in. And you might even ask, what are some other things that you feel are contributing to your stress right now? And give the client the option to fill in some other things that maybe they didn't think about in that prior session, or they didn't have time to bring up other things. And I'll tell you, one of the reasons why this can be really powerful is with this particular client, not only did the other bubbles get filled in, but the client got so much energy from seeing all these pieces written down. And he started drawing arrows connecting certain bubbles to others and describing the ways that he saw these pieces impacting each other. And I'll also mention, you might notice on this example that some of the bubbles are bigger than others. And so some of that is the client drew these bigger bubbles to represent things that were, this is causing the most stress for me right now. And so I want to represent that. That can be really powerful for our clients, especially our clients that might be more visual learners and thinkers. And just to come full circle with this example, so, you start out with just a few of the bubbles filled in from a prior session, and you allow the client to continue to reflect on that and think about other things that might be contributing before really narrowing down on what the focus might be for that session, and what that agreement might be at the end of the session. So, in that last slide, you saw that clutter and disorganization was the biggest bubble, and it was the most pressing for this client to talk about. So the client's all energized, filling out other bubbles. Let's pull out another sheet of paper and let the client keep going. So with this client, some of the things that contribute to the clutter and disorganization in your life. And then all the other bubbles get filled in. I think the important piece with this is how it can help keep your conversation focused. So you can keep bringing it back to, here's some of the things that have come up. We can go through each one of these and have a discussion about that, but being able to bring it back to something that you can both see, that can be really helpful for keeping that conversation focused. And in this case, it's really more on the side of what's going on before getting to what's my goal. So you could use this to brainstorm strategies that the client could envision to help them reach their goal, and have a focused discussion about how each of those strategies may fit best within their current lifestyle. This is the Readiness for Lifestyle Change assessment, and this is on page 58 in your manual. This is a tool that could be useful after you've had some exploration about what changes the client is interested in considering. And I want to emphasize after the exploration piece. The timing of using this tool could be really crucial. And it really wouldn't make sense until the client has really narrowed down to a specific behavior that they're thinking about making a change in. And you want to make sure that that's the behavior that the client really wants to focus their energy. So with this tool, it would help the client assess for themselves, what is my level of readiness to make a change? And this can also help us figure out if there might need to be more discussion and exploration before getting to a really narrowed, focused goal. I think another way that this can be useful is to identify specific areas that might be useful for more exploration. So some examples for follow-up questions that could come from this assessment based on some of the items would be, tell me more about your concerns and fears if you decide not to make a change. What environmental supports do you have to help you reach your goal right now? What environmental constraints do you foresee? And what are some strategies to overcome those constraints? And this tool could also be another way to check in with a client after they've attempted to reach various goals that they've set. It will help the client reflect on where they are in their journey towards reaching their desired goals. This is the ruler tool, which can be found on page 60 of your manual. The ruler tool can be used to help facilitate the action planning process. It's important to explore importance, confidence, and readiness as they relate to the client's action plan or goal for that week. And keep in mind that the ruler tool doesn't have to be on paper like this or like it is in the manual. It could be just a question that you pose that helps guide the client. So you may ask, on a scale of 1 to 10, with 1 being not at all important and 10 being the highest of importance, how important is your goal to improve nutritional habits? Or asking about readiness, you could say, on a scale of 1 to 10, how ready do you feel to make a change between now and the next time we meet? Or you could ask about confidence, saying, on a scale of 1 to 10, how confident are you that you can keep a food diary this week? And you may need to ask follow-up questions. In fact, I encourage you to ask follow-up questions. So, for instance, you might ask your client, what makes you an 8 and not a 7? And the reason for asking a question framed that way is that it can help build the client's self-efficacy. So you're getting them to explore and reflect on why they are confident in their goal for that week. Building their self-efficacy. You could also use this approach with other tools. Think about the wellness wheel. So you rated your satisfaction in this area a 6. What makes that a 6 and not a 5? And I know we mentioned when we talked about the wheel and discussing that another question you may need to ask is, what does that 6 mean to you? And I think after you've asked a question that can help build self-efficacy, so what makes you an 8 and not a 7, you might follow up with, what would it take to move from an 8 to an 8.5? And this can really help the client explore potential barriers that they may be thinking about, how to overcome those, or supports that they could utilize to really help them be successful. And it could also lead to a refinement of their goal. So for instance, the client may come to their own conclusion that trying to fit in their yoga 3 times a week will be more challenging and may not even be feasible, but they may be completely confident that if they change their goal to fitting yoga in 2 times a week, they would be like a 9.8 in confidence. And that's great. This is, again, we're asking these questions for the client's benefit. And we want to start small and build up to where they want to be. And another rule of thumb that I typically use with the ruler tool with regards to agreements or goals that the client is setting is that if they're not a 7 or higher in confidence for that particular goal, what refinements do we need to make? Because we want to see them be successful. This is the decisional balance tool, and an example of this can be found on page 61 of your manual. This tool is especially useful with clients who are contemplating a change. So again, you may have already done some exploration to determine for yourself that the client is in contemplation, and that this tool may be useful. This is helping to explore the pros and cons of making a change versus not making a change. And with this tool, it is important to always end the pros and cons discussion with the positive side for change. And what I mean by that is, if you'll notice, we have numbered the boxes in this tool. And this is to demonstrate the order of the questions that you would ask to guide the client through this decisional balance. So you may say, first, what are some of the benefits of staying the same or not making this change? What are some of those benefits? What would be good about not doing anything? And then you may ask, so what's the downside? What's the downside of not making this change right now? And this way you've talked about staying the same, you've talked about the benefits of that, and you've ended with the costs of staying the same, so that they've already built up this momentum to, now I can talk about, I'm excited about what could happen. So then talk about, on the other side, making the change. What are the negatives for making that change? And you want to start, again, with talking about the negatives so that you can end with the positives for change. So the last one would be, what are the benefits for making this change? And you want to allow the client time to reflect on each of these. Maybe they even want to make a list. Again, if you've got a client who's a visual thinker and they want to see it written down, then maybe you make this table for them and you just help walk them through it with some of the questions that you ask. Remember, exploration is supposed to be for the benefit of the client, not the coach. So our role is to help the clients explore their own desires, their capabilities, their goals for future development. And the goal is for the client to leave with some self-enlightenment, that they've reflected on their vision and they're continuing to do so. We want the client to leave with a pebble in their shoe, something that's just enough to make you keep thinking about it. So even if our clients don't make big changes during our coaching relationship, it doesn't mean that they're not going to continue to consider those changes.